Hello, my name is Radhika Srivastav. I represent a civil society organization called Hriday, which is based in Delhi, India. We basically work in the area of non-communicable disease prevention and control, working with different stakeholders like youth, with the government, with people living with NCDs. And we basically work in the area of multidisciplinary research, advocacy, public sensitization in the area of NCD prevention and control. From our point of view, the Indian NCD scenario, though there are, India has a very comprehensive national multi-sectoral action plan on NCD prevention and control, and the plan does have some very strong and important policy areas which need to be further strengthened in the country. There is an urgent need to really operationalize the plan. Particularly when it comes to NCDs which are related to diet and the food environment. There is a lot that can be done in India, both in terms of research, so for example, policy research in terms of where exactly are our policy gaps, what are the challenges, and importantly, what are opportunities where we can strengthen our food environment and food-related policies. That's number one. The other is in terms of an area where I feel which is extremely important is marketing of unhealthy foods and beverages to children and to young people. And this is an area where, though there is general agreement between different stakeholders, whether it is the government or researchers, academia, or even civil society, that there is a need to step up our action and policies in this area. However, there is a lack of evidence in terms of what would be strategies that would work, and local evidence is needed in terms of how international best practices can be contextualized and translated into the Indian context. Another area which I feel again is important in terms of the food and diet related environments with respect to NCDs is the whole issue of multi-sectoral collaboration, and it is not just collaboration between various government departments, but also transparent collaboration between different stakeholders, including the researchers, academia, civil society, policy think tanks, to really come together and discuss strategies which would work. So I would like to congratulate IDRC, the Asia office, and the National Institute of Epidemiology and Health here in Vietnam for organizing this consultation. Asia is in terms of its population size, a huge continent, and there is a need to really put our act together in terms of if we want to sort of really have an impact on global food environments. Asia is a continent where different countries need to come together. To the best of my knowledge, there hasn't been a space or a platform where different entities from various countries have come together. So, for example, we do have government representatives, we have civil society, we have academia, we have policy think tanks who've come together here to try and understand what could be some of the regional requirements or capacity building needs in terms of really stepping up our action in terms of food policy research for NCD prevention and control. And what is very interesting is that the mix of countries that have come together, there are some countries who have a very strong research and policy portfolios in terms of the work that they've done in this area, and this gives an opportunity for the other countries. For example, like in India, though we have a huge population size and NCDs is a huge public health challenge, but being here at this conference really contextualizes that, even though we are the second most populous country globally, there is a lot that needs to be done, and there's a lot that we can learn from what's happening in our neighborhood.